Regarding stroke in young patients, until the long case, when it comes long case, they will say to you, this lady, she has been complaining of left side weakness. Go and see his heart. You will take a history for doing the following. Can you tell? I understand that you are suffering from left side body weakness. Can you tell me more about that? Then he will start to tell you his story. Start immediately by these questions. When this problem starts exactly, they start slowly or gradually. This is the first time or you have previous attack before. Then 4 B's: progressions, precipitations, patterns, and pain. Progression, is it increasing, decreasing, or the same? Precipitation, do you notice anything increase it or improve it? Pattern, is it related to specific time of the day, and pain is associated with any pain? This is fixed question for any complaint. Whatever he came with any complaint, cough, shortness of breathing, chest pain, anything, this is your base. After that, go specific. Where is the side of this weakness exactly? In the right side of the body. Start from above down, full CNS. Do you have any headache? Yes. Do you have any double D, deviation of the mouth, any difficult of speech? These are theory. Then after that, you said to me the weakness only around the upper limbs or both in both sides. What is the nature of this weakness? Floppy or stiffy weakness? Then is it associated with any sensory loss? Then after that, what about water work control? You have any problem to control your water work? Any change in your gait, shape of your gait? Do full CNS analysis. After that, I understand from this full analysis, I got that this lady, she has got a left side body weakness. And her age is what? 32. She's young. Immediately I will say to him, you have left side body weakness for differential diagnosis. I will go to the second part of my discussion. Now, the first differential diagnosis is double MS. Double MS, if you got a lady, young patient having stroke, the first differential is double MS. The first MS is multiple sclerosis. Do you have any painful eye movements at all? Do you have any unsteadiness at all? Is this the first attack? Yes, thank you. Multiple sclerosis, take it. The second MS is mitral stenosis. Do you have any history of palpitations, abnormal racing of your heartbeat, any heart problem before? طبعا هنا في الام دي بنقول له كان عندك رطوبه في القلب in MD Sudanese exam بيقول في رطوبه كان في رطوبه في القلب. Do you have you ever diagnosed with any heart problem before? Be specific with it. Any leg swelling to rule out even the patent foramen on vein. I rule out double MS, multiple sclerosis, mitral stenosis. Go to the rule of S's. The first S is stroke in young patients. Do you have any high blood cholesterol? Feed you home? Any high blood pressure and high blood sugar? Any history of smoking? Because type 3 familial hyperlipidemia can cause stroke. عديل أسأل من الدهون. Do you have any history of high blood cholesterol? The second S is stroke. The first S is stroke. The second S is space occupying lesion. Any headache increased by coughing, sneezing, bending for work. The second S is what? Is sickle. Do you have any painful in the joints at all? Have you ever visit hospital frequently because of painkiller for sickle cell disease? The last S or the fourth S because of subarachnoid hemorrhage due to either polycystic kidney, any change in your water work, amount, color, frequency, any painful pain in your glands, any blood urine at all, then, but even hereditary hemolytic indicators, they have rupture melanism, any skin rash at all. And the last S is any serious infections before, any history of high temperatures because of what? Encephalitis can cause what? Stroke in young patients. Any serious head trauma, serious infection and serious head trauma, and say bye-bye by any history of blood clots before in the family or inside you. Can I ask you private questions? Any history of previous miscarriage for antiphospholipid syndrome and factor 5 Leiden deficiency, if you remember. Am I right? Thrombophilia. To sum up for you, if you got stroke in young patients, do full analysis of the CNS, then after that do what? Go for the differential diagnosis. Number one, double MS, multiple sclerosis, mitral stenosis. Then go for SSSS. The first S is stroke due to hyperlipidemia. The second S is sphenocytic lesion. The third S is subarachnoid hemorrhage due to polycystic kidney. I saw in my life a patient young having rupture vein aneurysm, and he's young. The source S is sickle cell disease, and the last S is serious infections or serious what? Trauma, even the trauma to the neck, carotid artery dissections, if you remember. Then finishing by any history of blood clots. Then do for him past medical history, family history, drug history, social, then summary. Am I right? In the social, so the SMD exam, don't forget the impactions. What is your job? How this disease affecting you in your job and daily activities. And summary, I would like to summarize to you that you are suffering from left side body weakness. It started since 1 year ago, and you have heart problem as you said to me before. Can I ask you, would you like to add anything? No. What is your concern? ما يشغلك شيء. Then after that he will tell you, my concern is what is wrong with me. Tell him that right now I take a history from you. Let me examine you. After examination, I will tell you, I will do my best to tell you what is wrong with you. Then go and examine you. Till this point, this is 7 minutes. Go your examination in 7 minutes, divided into 2 parts. As you got it, there is start by the upper limbs or the lower limbs to confirm there is signs of upper motor neuron lesions which is weak, and do immediately go to the pulse. Stroke. Go to the pulse. Groovy, carotid groovy. Then go to mitral, tricuspid, pulmonary, aortic, and focus in the mitral. As in this lady, now you got it, she has got signs in the right lower limb, she has got a signs of upper motor neuron lesion in the form of hypertonia, hyperreflexia, upgoing plantar, bilateral shape of weakness. Cardiovascular examination, the BAMA بتاعتك. The pulse is regular. Now the pulse is regular. Am I right? Did you get it regular? The pulse is regular. And the apex is undisplaced stabbing in nature. And there is mid-diastolic rumbling matter in the mitral area. Best here when the lady in the left lateral position on expirations. And the first heart sound is loud. My summary for this lady, a case of mitral stenosis most likely complicated by thromboembolic complications. Very clear mid-diastolic mirror. Anybody look here? Anybody? في واحد ما شاف ما سمع؟ This case is clear يا جماعة? Yes. Then after that, they will go for you for discussion. What is the investigations you would like to carry out? Apart from basic investigation, CBC, RFT, LFT, electrolyzing, inflammatory markers. I need to do for this lady the following: imaging, CT, carotid, Doppler, ECG, and echocardiography. The discussion will go deep, because there is no time. I think that's clear now how to approach any stroke if you got it in long case, stroke in young patient. Clear? Second patients.